All right, so mechanical chest compression devices were also tested in a long-term trial in Oslo. Now, this trial took place over 3 years and it tested the survival rates of patients who received mechanical chest compressions versus manual chest compressions. As we can see, the survival rates with mechanical chest compressions are much higher than with manual, in fact, almost a 5-fold increase. So this suggests that mechanical chest compressions devices can greatly increase survival rates. Now, within the United States, 2 major agencies have adopted these mechanical chest compression devices to use on their ambulances, and that is the Memphis Fire Department and the Richmond Ambulance Authority. Now, in Memphis, they took data on the return of spontaneous circulation in mechanical versus manual compressions. Return of spontaneous circulation is a measure of success in CPR because it demonstrates that circulation has returned to the patient. Now, these rates with mechanical, as we can see, are much higher than with manual, more than a 2-fold increase. And Richmond, although it didn't take statistical data, noted a significantly improved survival to hospital discharge in their patients. Now, the Pennington First Aid Squad within Hopewell Township has actually recently invested in a mechanical chest compression device. So for background, there are 4 different agencies within Hopewell Township that provide emergency medical services: the Pennington First Aid Squad, the Hopewell Valley Emergency Services, the Titusville Fire and Rescue Squad, and the Hopewell Borough Fire and Rescue Squad. And Pennington is just one of these. Now, it's had this mechanical chest compression device for almost a year, and although there is little conclusive data yet, members have reported saved lives with this mechanical chest compression device in use. And also just in general, they've reported that it's easier to maneuver in tight spots, especially stairwells were mentioned during CPR calls. All right, so now I'd like to investigate a certain mechanical chest compression device, which is the Lucas. Now, 2 mechanical chest compression devices currently dominate the market, and that is the Lucas, the Lund University Cardiac Assist System, and the AutoPulse. Now, the difference between these 2 is a structural one. The Lucas applies pressure directly to the sternum, and the AutoPulse applies this pressure all over the chest, just kind of generally squeezes the chest. So a recent study was done on pigs actually in cardiac arrest, and it compared these 2 different systems. Now, up to this point, all of the comparisons have been mechanical versus manual. This is just between 2 mechanical devices. So this study showed that there was increased cardiac output in the Lucas as opposed to the AutoPulse with this study in pigs. And cardiac output is important because it demonstrates that blood is circulating through the heart. And also in terms of cost, the Lucas has been shown to be more economical because it's $4,000 cheaper than the AutoPulse. So with the cost consideration, that's a more economical choice. So my plan for improving the quality of CPR in Hopewell Township starts with the purchase of Lucas machines for the 3 remaining squads that have not already purchased a mechanical chest compression device. And with the purchase of these machines, it's imperative to train the members so that they understand how to use these machines in a time-sensitive setting. So for training, we will also purchase a mannequin that's capable of providing automatic feedback, which will show the rescuers how the blood is circulating within the body, whether the machine has been applied so that the adequate rate and depth have been achieved. So that mannequin will help members gauge where they are. Also, just practically how this training is going to go down, the squad captains will be responsible for instituting a 3-month training period. Now, this 3-month period will work in such that members will have 3 months to prove that they're capable of using this Lucas machine, that they're able to apply it in 15 seconds or less so that no time is wasted during CPR, and that they're capable of putting it on the patient so that the recommended rate and depth of CPR are achieved. And if they can't do this within 3 months, then they rescind their right to provide emergency services in Hopewell. And then in addition to this initial training period, there will be reinforcement throughout the year, twice a year, to make sure that emergency services providers in Hopewell know what they're doing at all times regarding CPR. So